Support for Trifles comes from the BSI Press. Manuscripts, collections of papers by international writers, and books covering a wide range of other Sherlockian topics. Find them online at bakerstreetirregulars.com. And by listeners like you, who choose to support us on Patreon for as little as $1 a month. Patreon.com/trifles. Welcome to Trifles, a weekly podcast about the Sherlock Holmes stories.
It is, of course, a trifle, but there is nothing so important as trifles.
Yes, there were men that were dancing, creeping, and crooked, but there are so many other details to pick apart in the stories.
Pray, be precise as to details.
You know the plots, but what about the minutiae? What's a tantalus? Or a gasogene? And what's the difference between a hansom cab and a four-wheeler?
You are very inquisitive, Mr. Holmes.
It is my business to know what other people don't know.
Scott Monty and Burt Wolder will have the answers to these questions and more in Trifles.
The game's afoot.
Episode 300, Langurtin. Hello, and welcome to this very special episode of Trifles, the Sherlock Holmes podcast where we look into the details in the Sherlock Holmes stories. I'm Scott Monty.
I'm Burt Wolder.
And Burt, are you ready to be rejuvenated today?
Nobody is more ready than I.
Well, you're in the right place. This is going to be a very different episode of Trifles, kind of a fun one that is celebrating our 300th episode here. You may have noticed in the introduction there that we mentioned this is show number 300. Can't believe we've been doing this for, well, over 299 episodes. What's next?
Hard to say. It's just amazing. You know, maybe we need a new method of counting.
Well, I'm going to... Did you know, and this was horrifying to me, they're actually using Arabic numbers in U.S. schools? It's a shame what's happening to the educational system.
You're kidding. Who will allow... I want to see somebody who's responsible for importing all those. You know, you're telling me that there are container ships full of ones and zeros and twos and threes and nines coming into this country from the Middle East?
Can you believe it? And from all over. From all over.
Oh, my goodness.
Who knows? Well, this, as I said, is episode 300, as we say in Arabic numerals. You can find the show notes at ihose.co/trifles300. Don't forget that if you are a Patreon supporter, then we, first of all, thank you. And we do have a drawing at the end of the show, just to remind you. It's the end of the month and the end of the quarter, so we're drawing for a free back issue of the Baker Street Journal and a free annual subscription to the Baker Street Journal, including the Christmas annual, for which all of our Patreon supporters are eligible. And to become a Patreon supporter, just go to patreon.com/trifles or check us out at the show notes there at ihose.co/trifles. And of course, if you have ideas for future shows, we're already beginning the planning process for season 7 in 2023. But if you have an idea for something you'd like us to discuss here on the show, please let us know by emailing us at trifles@ihearofsherlock.com. Well, we promised a very different episode this time around, and in fact, we have one. We enjoyed ourselves talking about Lowenstein of Prague in the last episode. It was one of our master's classes where we look at award-winning or exemplary Sherlockian scholarship and share it with you and provide some of our interpretation along the way. And in episode 299, we talked about the article Lowenstein of Prague, which was written by Al Silverstein and Jan Prager, all about the interactions with Professor Presbury in The Creeping Man. Well, we actually unearthed a really interesting entry, a very different entry in the Baker Street Journal from 1997. It was volume 47, number 3, and it was It was basically a pharmaceutical ad, or what looked like a pharmaceutical ad that you might encounter in any typical magazine. And it was contributed by Jeff and Wanda Dow. And we'd like to read the ad in as creative way as we know how, and hope that you enjoy this humorous journey with us as well. So, Bert, why don't you tell us all about this revolutionary new pharmaceutical?
I'll be happy to do that. And it's one of those things that, folks, if you have ever looked at the advertisements for pharmaceuticals in magazines and newspapers and looked at all those pages and those tiny bits of type, well, there's a lot of satire and fun in this product here by Jeff and Wanda Dow. And it is presented in the Baker Street Journal, as Scott just said, a source not usually associated, he said kindly, with satire and comedy. But it's presented even down to an illustration of a pill with the trade name on it. And that's why we're sharing it with you today as this advertisement. So, friends, are you tired? Are you confused? Are you weary? Ask your doctor for a trial of once every 9 days. Langurtin. Experience the youth you once had and can have again. An old European remedy for a new American person. Rejuvenated and be able to do everything you once could do. Rejuvenated for nearly 2 weeks at a time. 1 dose per 9 days provides effective relief from the effects of time. Rejuvenated with a low occurrence of side effects. Side effects occurred as often as they did with placebo or sugar pill. Most common were knuckle walking, occurring with 12%, poking sticks at dogs, 8%, wall climbing, 4%, and dry mouth, 3% of patients. Notify your doctor of other medications you're currently taking. Consult your doctor for important information concerning this product. And for a $5 coupon and important free information about rejuvenation, call 1-800-305-DORAC. That's 1-800-305-DORAC. Extension 09. Yes, it's once every 9 days. Look young, feel young, be young. With Langurtin 10 milligram tablets, a product of Lowenstein Pharmaceutical Laboratories, Prague.
Langurtin tablets, long-acting rejuvenatory systemic dosage, RSD. Brief summary. For full prescribing information, see package insert. Indications and usage. Langurtin tablets are indicated for the rejuvenation of the human body. Contraindications. Langurtin tablets are contraindicated in patients who are hypersensitive to this medication or to any of its ingredients. But we're not going to tell you what they are. Precautions. General. Patients with liver impairment or renal insufficiency should be given a lower initial dose because they have reduced clearance of Langurtin tablets. Drug interactions. Langurtin, 10 milligrams once every 9 days, has been safely co-administered with therapeutic doses of erythromycin, cimetidine, and ketoconazole in controlled pharmaceutical studies. Although increased plasma concentrations of Langurtin and or descarboethoxylangurtin were observed following the co-administration of Langurtin with each of those drugs in normal volunteers, N equals 24 in each study. There were no clinically relevant changes in the safety profile of Langurtin as assessed by electrocardiographic parameters, clinical laboratory tests, vital signs, adverse events, and throws of the dice. There were no significant effects in QTC intervals and no reports of sedation or syncope. No effects on plasma concentrations of cimetidine or ketoconazole were observed. Plasma concentrations, AUC 0 to 24 hours, of erythromycin decreased 15% with co-administration of Langurtin relative to that observed with erythromycin alone. The clinical relevance of this difference is unknown, but we'll eventually make something up. These above findings are summarized in the following table, which has the longest title in the known universe. Effects on plasma concentrations, AUC 0 to 24 hours of Langurtin and descarboethoxylangurtin after 27 days at co-administration Langurtin 10 milligrams in normal volunteers. Erythromycin dosage with Langurtin increased 40%, while cimetidine increased 103% and ketoconazole 307%. 3 volunteers were Sherlockians, so we cannot vouch for their normalcy.
There does not appear to be an increase in adverse events in subjects who received oral contraceptives and Langurtin, carcinogenesis, mutagenesis, beatnikism, and impairment of fertility. In an 18-month oncogenicity study in mice, a 2-year study in rats, and a 5-day study of the Caribbean islands, Langurtin was administered in the diet at doses up to 40 milligrams per kilogram of mice and 25 milligrams per kilogram in rats. In the carcinogenicity studies, pharmacokinetic assessments were carried out to determine animal exposure to the drug. AUC data demonstrated that the exposure of mice given 40 milligrams per kilogram of Langurtin was 36 of Langurtin and 16 active metabolite, times higher than a human given 10 milligrams over 9 days. Exposure of rats given 25 milligrams per kilogram of Langurtin was 28 for Langurtin and 67 active metabolite, times higher than a human given 10 milligrams over 9 days. Male mice given 40 milligrams per kilogram had a significantly higher incidence of sunglass wearing, combining turtlenecks and sandals, than concurrent controls. In rats, a significantly higher incidence of coolness was observed in males giving 10 milligrams per kilogram and males and females given 25 milligrams per kilogram. The clinical significance of these findings during long-term use of Langurtin tablets is not known. In mutagenicity studies, there was no evidence of mutagenic potential in reverse Ames or forward SERMA point mutation assays or in the assay for DNA damage with rat primary hepatocyte unscheduled DNA assays or in 2 assays for chromosomal aberrations, human peripheral blood lymphocyte clastogenesis assay and the mouse bone marrow erythrocyte micronucleus assay. In the mouse lymphoma assay, a positive finding occurred in the non-activated but not the activated charcoal phase of the study. Langurtin administration produced hepatic microsomal enzyme induction with overhead cams and fuel injection in the mouse at 40 milligrams per kilogram and rat at 25 milligrams per kilogram, but not at lower doses. Decreased fertility in male rats, shown by lower female conception rates, occurred at approximately 64 milligrams per kilogram and was reversible with the cessation of dosing. Langurtin had no effect on male or female fertility or reproduction in the rat at doses of approximately 24 milligrams per kilogram, but they really did not like to talk about it. Pregnancy, Category B. There was no evidence of animal teratogenicity in studies performed in rats and rabbits at oral doses up to 96 milligrams per kilogram, 75 times and 150 times respectively, the recommended 9-day human dose on a milligram per M2 basis. There are, however, no adequate and well-controlled studies in pregnant women because animal reproduction studies are not always predictive of human response. But it's fun to make them run around in those silly mazes. Langurtin tablets should be used during pregnancy only if clearly needed. Nursing mothers, Langurtin and its metabolite, descarboethioxylangurtin, pass easily into breast milk and achieve concentrations that are equivalent to plasma levels with an AUC over AUC plasma ratio of 1.17 and 0.85 for the parent and active metabolite, respectively. And if you know what that means, you need some serious help. Following a single oral dose of 40 milligrams, a small amount of Langurtin and metabolite was excreted into the breast milk, approximately 0.03% of 40 milligrams over 48 hours. A decision should be made whether to discontinue nursing or to discontinue the drug, taking into account the importance of the drug to the mother, but it wouldn't hurt to ask the kid either. Caution should be exercised when Langurtin tablets are administered to a nursing woman because her hands are full. Pediatric use, safety, and effectiveness in children below the age of 12 years have not been established because all of our rats and mice were older. And after all, what kind of a child really needs rejuvenation?
Well, we're going to take a quick break from our ad here and bring you another ad.
If you're a regular listener of Trifles, you'll know that we also have another show called I Hear of Sherlock Everywhere. And of course, we do hear of Sherlock everywhere around the globe, and it's partially due to the BSI Press. The BSI Press has been doing the international series for well over a decade, and it takes you to places that, well, you couldn't otherwise go without the BSI Press's help. And that is inside scholarship coming from Sherlockian societies from all corners of the globe. You'll find Japan and Sherlock Holmes, Scandinavia and Sherlock Holmes, Australia, Italy, Spain, Canada. The list continues to grow. So if you're interested in what people from all around the world have to say about Sherlock Holmes, find that common bond at the BSI Press website, BakerStreetIrregulars.com, and pick out an international volume of your choice today.
Adverse reactions. Approximately 90,000 patients received Langurtin tablets 10 milligrams once every 9 days in controlled, uncontrolled, and uncontrollable studies. Placebo-controlled clinical trials at the recommended dose of 10 milligrams once every 9 days varied from 2 weeks to 6 months duration. The rate of premature withdrawal for those trials was approximately 2% in both the treated and placebo groups. Reported adverse events with an incidence of more than 2% in placebo-controlled rejuvenatory systemic dosage clinical trials. Percent of patients reporting knuckle walking. In those taking Langurtin, 12%, whereas only 11% with a placebo, and only 8% when taking Youngertin, and 8% when taking Babyton. Stick poking comes in at 8% for Langurtin, while Youngertin produced results of 22% of subjects eliciting stick poking. Wall climbing was similar, with 10% taking Youngertin and only 4% taking Langurtin. And finally, dry mouth across the board between 2 to 4%, Langurtin, placebo, Youngertin, and Babyton. Adverse events reported in placebo-controlled idiopathic or idiotic chronic urticaria trials were similar to those reported in any of Stephen King's books. Adverse event rates did not appear to differ significantly based on age, sex, race, shoe size, hat size, or ring size, although the number of non-white subjects was relatively small because we couldn't find any non-white subjects gullible enough to take those silly pills. In addition to those adverse events reported above, the following adverse events have been reported in 2% or fewer patients. Autonomic nervous system. Altered lacrimation, altered salivation, flushing, hyposthesia, impotence, increased sweating, thirst, jimmy legs, and the desire to watch YouTube. Body as a whole. Angioneurotic edema, asthenia, back pain, blurred vision, chest pain, conjunctivitis, earache, eye pain, fever, leg cramps, malaise, rigors, tinnitus, upper respiratory infection, weight gain, weight loss, pectoral muscles like Arnold Schwarzenegger. Cardiovascular system. Hypertension, hypotension, surface tension, palpitations, syncope, syncopation, tachycardia, tachydressing. Central and peripheral nervous system, blepharospasm, dizziness, dysphonia, telephonia, telegraphia, hyperkinesia, migraine, paresthesia, tremor, vertigo, and rear window.
Gastrointestinal system, abdominal distress, altered taste, including rap, punk rock, and hip-hop, anorexia, constipation, diarrhea, dyspepsia, flatulence, gastritis, increased appetite, decreased appetite, nausea, stomatitis, toothache, vomiting, and toilet hugging. Musculoskeletal system, arthralgia, myalgia, uralgia, everyone's algia. Psychiatric, agitation, amnesia, anxiety, confusion, decreased libido, depression, impaired concentration, insomnia, nervousness, paranoia, not to be confused with paranoia, and many other symptoms commonly associated with parenthood. Reproductive system, breast pain, dysmenorrhea, menorrhagia, womenorrhagia, vaginitis. Respiratory system, bronchitis, bronchospasm, busting bronchos, coughing, dyspnea, epistaxis, episbuses, epistrains. Hemoptysis, nasal congestion, nasal dryness, laryngitis, pharyngitis, sinusitis, attorneys at law. Sneezing, doping, and dosing, skin and appendages, dermatitis, dry hair, dry skin, photosensitivity reaction, prurititis, say that fast real time, say that real fast 5 times, purpura, rash, urticaria, urtivania, urtigepia. Urinary system, altered micturition, urinary discoloration, leaving the toilet seat up. In addition, the following spontaneous adverse events have been reported rarely during the marketing of Langurtin. Abnormal hepatic function, including jaundice, hepatitis, and hepatic necrosis, alopecia, anaphylaxis, breast enlargement, erythema multiforme, peripheral edema, seizures, and supraventricular tachyarrhythmias, lacrosse playing and listening to Bobby Vinton albums.
Overdosage. Somnolence, tachycardia, headache, and constant viewing of the Golf Channel have been reported with overdoses greater than 10 milligrams. In the event of an overdosage, general symptomatic and supportive measures should be instituted promptly and maintained for as long as you can stand to give up cable TV. Treatment of overdosage would reasonably consist of emesis, ipecac syrup, except in patients with impaired consciousness, often found subsequent to watching the Golf Channel, followed by listening to episodes of Trifles. Oral LD50 values for Langurtin were greater than 5,000 milligrams per kilogram in rats and mice. Doses as high as 10 times the recommended clinical doses showed no effect in rats, mice, and monkeys. Lowenstein Pharmaceutical Laboratories, Prague. Copyright 1996, Lowenstein Pharmaceutical Laboratories, all rights reserved.
Not available in California.
Yeah, it's one of those things that, by the time you get through all of the contraindications and adverse effects, it's why would you even bother taking this drug?
I think that, but that clearly, the pharmaceutical industry spends so much money advertising studies and making postings of these aspects of new therapies and medications. I imagine there must be a significant percentage of the readers of magazines and newspapers and cable TV watchers that grab all this information and just zoom off to their physician and say, look, You're probably not keeping up with the latest medical journals, but I'm reading, Newsweek, and look, this is for me. Sign me up.
I found this in my latest issue of Ranger Rick. Why aren't you prescribing it to me?
That's right.
Well, this ad actually appeared at an interesting inflection in time. As we said, it was from the 1997 third volume of the Baker Street Journal. In 1998, we actually have the marketing of sildenafil, which is or was commercially known as Viagra. So that started in 1998 after Pfizer had discovered the medication in 1989, looking for heart-related chest pain treatment. By accident, they found that Viagra had, other side indications, shall we say. And so this was coming at a very auspicious time in the pharmaceutical marketing world. So, well, let's turn to the final feature of our show, where we actually get to pick a couple of winners this time. We have our monthly drawing for a back issue of the Baker Street Journal, and then we have our second drawing, which is for an annual subscription to the Baker Street Journal. So let's begin, and I need to put make sure that the numbers on the wheel here are up to date, because we've had a few more people add themselves to the roster of our Patreon. And again, this is for anyone who is a Patreon supporter of Trifles. You can do that at patreon.com/trifles. And let's pull out the big prize wheel and give it a big spin. And it's landing on number 23, and that looks like it corresponds to Brooke Hall. Brooke, congratulations. We'll be sending you a back issue of the Baker Street Journal. And our next winner for an annual subscription for the Journal, which includes the Christmas Annual. It's the only way you're going to get the BSJ Christmas Annual is by having an annual subscription. And we're going to give the wheel another spin. All right. And it comes down to number 28. And it looks like that is Douglas Vaughn. Congratulations to you. Thank goodness for random number generators and prize wheels. Well, if this intrigued you at all, if you're having fun with what we're doing here in the first 300 episodes, I don't know how much longer we're going to be able to keep this going, but it seems like there's always something trifling in the pages of Sherlock Holmes or associated publications.
Yes. Well, the prospect of not going fills me with agitation, amnesia, anxiety, confusion, decreased libido, depression, impaired concentration, insomnia, nervousness, and paranoia. So we must keep going.
Well, maybe a little Langurtin is exactly what you need. But just a trifle.
It is, of course, a trifle, but there is nothing so important as trifles.
Please join us again next week for another installment of Trifles. Show notes are available on SherlockHolmesPodcast.com. Please subscribe to us on Apple Podcasts and be sure to check out our longer show, I Hear of Sherlock Everywhere, where we interview notable Sherlockians and share news of the Sherlockian world.
You've taken my breath away, Mr. Holmes.
The animal extract to be sold at enormous profit to those foolish or desperate enough to imagine that a course of serum could restore their lost vitality without any other effect.